Get that child away from my clean waiting room before he infects everyone here. Dr. Rebecca Stone's voice sliced through the chaos of City Medical Center's emergency room at 11:42 p.m. on a Tuesday. Her white coat was pristine. Her expression, pure disgust. The woman holding the shivering 7-year-old boy didn't move. She stood there in her simple jeans and sweater, her son's face buried against her shoulder. His small body trembled with fever. "Ma'am, did you hear me?" Dr. Stone stepped closer, her voice rising. "This isn't a free clinic. Take him to the county hospital where you people belong." You people. The words hung in the air like poison gas. 15 patients looked up from their phones. A nurse froze mid-step. And somewhere in the back of the waiting room, a college student hit record on her phone. Nobody knew it yet, but the next 20 minutes would destroy careers, spark national outrage, and change hospital policy across 3 states. Have you ever watched someone make a mistake so catastrophic that you knew their life would never be the same? This is that story. Let me back up for a second. Lauren Mitchell had spent her evening at a charity gala downtown. Black dress, pearl necklace, hair perfectly styled. She'd been the keynote speaker at the Pediatric Healthcare Fundraiser, discussing her foundation's work providing medical care to underserved communities. Then her phone rang. Her son Tyler's babysitter panicked. "Miss Mitchell, Tyler's burning up. His temperature is 103.5. He won't stop shaking." Lauren didn't even grab her coat. She ran out of the gala, drove 20 minutes in her bare feet because she'd kicked off her heels, and pulled Tyler from his bed. City Medical Center was the closest ER. She'd donated $500,000 to their pediatric wing last year. She didn't think about changing clothes. She didn't think about how she looked. She only thought about her baby. Now she stood in their waiting room, holding Tyler close, trying to stay calm while a doctor treated her like garbage. "I have insurance," Lauren said quietly. "My son needs help. His fever won't break." Dr. Stone laughed. Actually laughed. "Insurance? Let me guess. Medicaid? State assistance?" She turned to the security guard standing nearby. "Michael, we've talked about letting random people through the doors after midnight. This is exactly what I meant about our security problem." Michael, the guard, looked uncomfortable. He'd worked at City Medical for 12 years. He knew something felt wrong about this situation, but Dr. Stone was senior staff. She'd been here for 20 years. Who was he to question her judgment? "Ma'am, I'm going to need to see some ID," Michael said reluctantly. Lauren shifted Tyler's weight and reached into her back pocket. Her wallet was still in her car. In her panic to get Tyler inside, she'd left everything behind. "It's in my car," she said. "But my son is very sick. Can someone please just look at him while I—" "Absolutely not," Dr. Stone interrupted. "No ID, no insurance verification, no treatment. Hospital policy." She crossed her arms. "For all we know, that child isn't even yours." The accusation hit like a slap. Want to know the crazy part? This wasn't even the worst thing Dr. Stone had done that night. Just wait. Tyler whimpered against his mother's shoulder. "Mommy, my head hurts really bad." His voice was so small, so weak. Every parent in that waiting room felt it in their chest. "But Dr. Stone?" She rolled her eyes. "Listen, sweetheart," Dr. Stone said, her tone dripping with fake sweetness. "I'm sure whatever clinic you usually go to is very nice, but City Medical Center serves a specific demographic. We have standards here, expectations." A young woman named Jessica Chen, sitting in corner chair 12, couldn't believe what she was hearing. She'd been waiting for 3 hours with a sprained ankle, scrolling through social media, bored out of her mind. Not anymore. She pulled up TikTok, hit the live stream button, and pointed her phone directly at Dr. Stone. "Y'all seeing this?" Jessica whispered to her 3,200 followers. "This doctor is refusing to treat a sick kid." The viewer count started climbing immediately. 47 viewers, 89 viewers, 156 viewers. Lauren tried one more time. Dr. Stone, I understand your concerns, but my son's fever is dangerously high. If someone could just take his temperature, check his vitals. What part of no don't you understand? Dr. Stone turned to address the entire waiting room now, playing to her audience. This is why our healthcare system is broken, people. Everyone thinks they deserve immediate care without proper documentation or insurance verification. She was giving a speech, using Tyler, a terrified 6-7-year-old, as her example of what's wrong with America. Here's the thing about assumptions. They're like grenades. Pull the pin, and everyone gets hurt. Michael, the security guard, stepped forward again. Ma'am, I really am going to have to ask you to either provide identification or what? Lauren's voice was still calm, but something had shifted in her tone. You'll physically remove a sick child from a hospital? If necessary, Dr. Stone answered for him. We have actual patients to treat, paying patients, people who belong here. The live stream viewer count hit 1,000, then 2,500. Comments flooded Jessica's screen faster than she could read them. Is this real? Someone call the news! That doctor needs to be fired immediately. This is absolutely disgusting. Tyler started crying softly. Not loud, attention-seeking crying. The quiet kind that breaks your heart. The kind that says a child hurts too much to even cry properly. Lauren kissed the top of his head. It's okay, baby. Mommy's going to fix this. And that's when her phone rang. The caller ID said, Angela, office. Angela was Lauren Mitchell's executive assistant. It was almost midnight. Angela never called this late unless something was seriously wrong. Lauren answered, putting it on speaker since her hands were full holding Tyler. Ms. Mitchell? Thank God. I saw the security alert that you left the gala early. Is everything okay? Tyler's sick, Lauren said simply. We're at City Medical Center, but there's been a complication. What kind of complication? Dr. Stone scoffed loudly. Oh, this should be good. Let me guess. Calling your boyfriend to come intimidate us? Your baby daddy to cause a scene? The racist assumption was so blatant that several people in the waiting room gasped out loud. No, Lauren said calmly. I'm calling my assistant to bring my identification, since that seems to be the issue preventing my son from receiving medical care. Angela's voice came through the speaker, confused. Ms. Mitchell, do you want me to contact hospital administration? I can have them on the phone in 2 minutes. That won't be necessary, Lauren said, her eyes never leaving Dr. Stone's face. Just bring my credentials, all of them. Something in her tone made Dr. Stone pause, just for a second, but her arrogance won out. Credentials? Dr. Stone laughed again. What credentials could you possibly have that matter here? Oh, this was about to get good. The live stream viewer count hit 5,000. Here's what nobody in that waiting room knew yet. Lauren Mitchell wasn't just a concerned mother. She was Dr. Lauren Mitchell, MD, PhD, Chief of Pediatric Surgery at Metropolitan Hospital across town. Professor at the State Medical University. Winner of the National Medical Association's Excellence in Healthcare Award 3 years running. And, this is the important part, she was on the board of directors for the entire City Medical Hospital Network. The hospital network included City Medical Center, the hospital where Dr. Rebecca Stone worked. But Lauren hadn't revealed any of this yet. She was waiting, watching, documenting every word, every action, every assumption. Why? Because she'd heard rumors about Dr. Stone for months, complaints from minority patients about discriminatory treatment, whispers from nurses about racist comments, stories that could never be proven because they always happened behind closed doors. Until now. My assistant will be here in 15 minutes, Lauren said calmly. We can wait. She walked to the nearest chair and sat down, adjusting Tyler in her lap. He was getting worse. His breathing was shallow. His skin felt like fire. Every maternal instinct in her body screamed to fight harder, to demand treatment immediately. But the doctor in her, the strategist, the long-term thinker, knew that 15 more minutes of documented discrimination would create the evidence needed to prevent this from ever happening again. Dr. Stone turned to Nurse Melissa Rodriguez, who'd been watching the entire confrontation with growing horror. "Melissa, call hospital security. Real security, not just Michael. I want this woman and her child removed before other patients start complaining." Melissa didn't move. "Dr. Stone, the child clearly needs medical attention. Maybe we should at least take his temperature." "Did I ask for your opinion?" Dr. Stone snapped. "You're a nurse. Your job is to follow my orders, not question them." The power dynamic was crystal clear. Dr. Stone was used to being obeyed without question. Melissa pulled out her phone, but instead of calling security, she texted the night shift supervisor. "Emergency in ER, come now. Dr. Stone's situation." Smart woman. Jessica's live stream had grown to 8,000 viewers. The comments section had evolved from shocked reactions to organized action. "Someone find out what hospital this is. I'm calling their administration right now. Screenshot everything for evidence. This is going to destroy her care." One comment caught Jessica's attention. "Wait, is that Lauren Mitchellis? The Lauren Mitchell from the pediatric conference?" Jessica zoomed in on Lauren's face. Another comment. "OMG, it is her. That doctor has no idea who she's messing with." The pieces were starting to come together for the people watching online. But Dr. Stone? She was still completely clueless. Tyler's condition was getting worse. Lauren could feel it. His fever was climbing. His breathing was more labored. She'd been in medicine long enough to know the signs of potential meningitis or sepsis. Time was running out. "Dr. Stone," Lauren said, her voice steady despite her growing fear. "My son's symptoms suggest a possible bacterial infection. If he's developing sepsis, every minute matters. Please, just examine him." "Oh, now you're trying to diagnose him yourself?" Dr. Stone mocked. "Did you get your medical degree from Google?" The irony would have been hilarious if a child's life wasn't at stake. The waiting room doors burst open. Angela rushed in, designer briefcase in hand, still wearing her evening gown from the gala. She'd literally left a $500-a-plate fundraiser to deliver documents to her boss. "Ms. Mitchell, I brought everything from your office." Angela handed Lauren a leather portfolio, the kind executives carry to board meetings. Lauren opened it carefully, making sure Dr. Stone could see everything inside. Business cards, hospital credentials, board member identification. Dr. Stone's confident smirk started to crack around the edges. "Now," Lauren said quietly, "let me properly introduce myself." She stood up, still holding Tyler with one arm, and pulled out a business card with her free hand. "I'm Dr. Lauren Mitchell, Chief of Pediatric Surgery at Metropolitan Hospital, Professor of Medicine at State University, and as of 6 months ago, board member for City Medical Hospital Network." The color drained from Dr. Stone's face like someone had pulled a plug. "The hospital network that includes this facility," Lauren continued. "The network whose board meetings I attend monthly. The network whose policies I help create. You know that feeling when you realize you've made a mistake so huge that there's no way to undo it? That's where Dr. Stone was right now. "Dr. Mitchell," she stammered. I didn't recognize—" "Recognize?" Lauren's voice was still calm, but there was steel underneath now. "Why would recognition matter? Should medical care depend on whether you recognize someone?" Michael, the security guard, wanted to disappear into the floor. He'd seen enough disaster movies to know how this ended. The live stream viewer count exploded past 15,000. Night supervisor David Park arrived, slightly out of breath from running. He took one look at the scene: Dr. Stone's pale face, Lauren's business cards, Tyler's obvious distress, and immediately understood he was looking at a career-ending disaster. "Dr. Mitchell," David said carefully, "I apologize for any confusion. Let's get your son into an examination room immediately." "Confusion?" Lauren repeated. Is that what we're calling blatant discrimination now? She turned to look directly at Jessica, who was still live streaming everything. Let me be very clear for everyone watching, whether in person or online. My son was denied medical care tonight. Not because of insurance issues, not because of hospital policy, but because a doctor made assumptions based on my appearance. Dr. Stone tried to interrupt. I was simply following protocol. What protocol? Lauren's voice cut through like a surgeon's scalpel. Show me the written protocol that says you deny care to sick children based on their parents' clothing. Silence. Show me the protocol that says you can accuse a mother of possibly kidnapping her own child. More silence. Show me the protocol that allows you to make racist comments while a child's condition worsens. The silence was deafening now. David Park made an executive decision. Dr. Stone, you're suspended effective immediately. Please surrender your hospital credentials and leave the premises. You can't. I've been here for 20 years, and in 20 years, you never learned that every human being deserves dignity and respect? Lauren's question hit like a hammer. What exactly were you practicing all that time? Tyler moaned softly, reminding everyone why they were actually there. Examination room 3 is open, Nurse Melissa said quickly. Dr. Chen is on duty tonight. He can see Tyler right away. Lauren started walking toward the examination rooms, then paused. Angela, please contact our legal team. I want every complaint filed against Dr. Stone in the past 5 years reviewed. I want to know if this pattern of discrimination has been going on longer than tonight. Angela was already typing on her phone. On it. And David? Lauren looked at the night supervisor. This isn't over. Tomorrow morning, I want a full review of your ER protocols. If this could happen to me, someone with resources, education, and connections, imagine what happens to families who don't have those advantages. David nodded miserably. He knew this was about to become a national news story. Jessica's live stream had reached 25,000 viewers. Local news stations were already picking up the story from social media. Hashtags were trending. Your city medical scandal, ER discrimination, justice for Tyler. In examination room 3, Dr. James Chen, young, thorough, and deeply embarrassed by his colleagues' behavior, examined Tyler with gentle efficiency. Temperature 104.2, he said quietly. Elevated heart rate, signs of dehydration. We need to start IV fluids immediately and run a complete blood panel. Thank you, doctor, Lauren said softly. Now that Tyler was finally getting care, she could feel the adrenaline starting to wear off. Dr. Chen started the IV while speaking quietly. Dr. Mitchell, I want you to know that most of us don't. What Dr. Stone did tonight doesn't represent this hospital's values. Doesn't it, though? Lauren looked at him directly. She's been here for 20 years. How many times has this happened before? How many families were left without treatment because they didn't have the credentials to fight back? Dr. Chen had no answer, because they both knew the truth. This definitely wasn't Dr. Stone's first time discriminating. It was just the first time she got caught on camera. Tyler's eyes fluttered open. Mommy? I'm right here, baby. Am I going to be okay? Yes, sweetheart. The doctors are taking good care of you now. Through the examination room window, Lauren could see the waiting room in chaos. Hospital administrators were arriving. Security was escorting Dr. Stone out of the building. Reporters were starting to gather outside. Angela poked her head into the room. Ms. Mitchell, CNN is requesting a statement. So is NBC, ABC, and about 15 local stations. Your phone has 200 missed calls. Tell them I'll make a statement tomorrow. Tonight is about Tyler. But Lauren knew tomorrow would bring a reckoning unlike anything City Medical Center had seen before. Want to know the really wild part? Dr. Stone still didn't think she'd done anything seriously wrong. As security escorted her to her office to collect her belongings, she was already on her phone with her lawyer, spinning the story. This is all a misunderstanding. I was following hospital protocols. They're going to sue me because of political correctness. she didn't get it. Even with her career imploding around her, she genuinely believed she'd been justified. That's how deep prejudice runs sometimes. It blinds people to their own cruelty. Meanwhile, in examination room 3, Tyler's IV was working. His fever started to drop. The blood tests came back showing a severe strep infection, serious but treatable with antibiotics. "He's going to be fine," Dr. Chen told Lauren. "Another hour or two without treatment could have been dangerous, but we caught it in time." Another hour or two. That's how close Dr. Stone's discrimination came to causing real harm. Lauren sat beside Tyler's hospital bed, holding his small hand, and thought about all the families who didn't have her credentials, all the children who got turned away and never came back, all the preventable tragedies that happened because people like Dr. Stone saw skin color before humanity. This couldn't continue. By 3 a.m., Tyler was resting comfortably. His fever had dropped to 100.1. He was stable. Lauren stepped into the hallway to find David Park waiting nervously. "Dr. Mitchell, I want to assure you that City Medical takes this situation extremely seriously. Dr. Stone has been suspended pending a full investigation. We're reviewing all of her patient interactions from the past 5 years." "That's a start," Lauren said. "But we both know this is bigger than one doctor." "What do you mean?" "I mean your hospital has a culture problem. Dr. Stone felt comfortable being openly racist in a waiting room full of witnesses. That doesn't happen unless she believes there will be no consequences, unless she'd done it before and gotten away with it." David couldn't argue with that logic. "Tomorrow morning," Lauren continued, "I'm calling an emergency board meeting. We're going to implement immediate changes. Mandatory bias training for all staff, anonymous reporting system for discrimination complaints, patient advocates in every department, and most importantly, consequences that actually matter." That's a lot of change very quickly." "It should have happened years ago," Lauren said quietly. "How many families have to suffer before we act?" David had no answer. Jessica's live stream had finally ended after 4 hours, but the recorded video was everywhere. Twitter, Facebook, Instagram, TikTok, Reddit. The story had exploded beyond anyone's expectations. By morning, it would be on every major news network in the country. The sun was rising when Lauren finally took Tyler home. He was sleepy from the medication, but stable, safe, healthy. As she carried him into their house, her phone rang one more time. The president of the City Medical Hospital Network. "Lauren, I just saw the footage. I'm horrified, absolutely horrified. What can we do to make this right?" Lauren looked down at Tyler, sleeping peacefully in her arms despite everything he'd been through. "You can help me make sure this never happens again," she said simply. "Not here, not anywhere." 6 months later, City Medical Center looked different now. In the main lobby, a new plaque hung on the wall. "Every patient deserves dignity, respect, and care, no exceptions." The waiting room had been redesigned with input from community organizations. Signs in 12 languages welcomed patients. Patient advocates roamed the halls, ensuring everyone received equal treatment. The Tyler Mitchell Protocol, named after Lauren's son, had been implemented across every hospital in the network. Immediate consequences for discriminatory behavior. Monthly audits of patient treatment patterns. Anonymous reporting systems that went straight to an independent review board. Dr. Rebecca Stone's medical license had been suspended for 2 years. During her appeal hearing, investigators found 17 formal complaints from minority patients spanning her entire career. 17 families who'd been dismissed, belittled, or turned away. The suspension became permanent. Jessica Chen, the college student who'd live-streamed the incident, received a journalism scholarship. Her video had been viewed over 8 million times and sparked national conversations about healthcare discrimination. Michael, the security guard who'd been caught in the middle, became a patient advocate. He used his experience to help train other security staff on recognizing and preventing discrimination. Nurse Melissa Rodriguez was promoted to patient care coordinator. Her quick thinking in contacting the night supervisor had been credited with preventing the situation from getting even worse. And Tyler? Tyler started third grade without any memory of that terrible night. He knew his mom was a doctor who helped sick kids. He knew she'd done something important at a hospital once, but the trauma had faded, replaced by normal childhood concerns like soccer practice and spelling tests. Lauren kept the video saved on her phone, though, a reminder of how close they'd come to tragedy, a reminder of why her work mattered. She testified before Congress about healthcare discrimination. She consulted with hospitals nationwide on implementing bias detection systems. She spoke at medical schools about the intersection of prejudice and patient care. The incident that could have destroyed her family instead became a catalyst for change, affecting millions of patients. Here's what this story is actually about. It's not about one racist doctor getting caught. It's about the systems that allowed her to discriminate for 20 years without consequences. It's about the families who suffered before Tyler, the ones who left that ER without treatment and never came back, the preventable illnesses that became serious because prejudice blocked access to care. It's about the fact that Lauren Mitchell had to be a board member, a renowned surgeon, and a person of influence to get her son treated. What about families without those credentials? Do their children deserve less care? The answer, obviously, is no. Every child deserves medical attention when they're sick. Every patient deserves respect regardless of their appearance. Every human being has worth that isn't determined by their clothes, their accent, or their skin color. That's not political correctness. That's basic humanity. Dr. Stone lost her career that night, but countless patients gained protections that will save lives for decades to come. The viral video is still online. Over 8 million views and counting. Comments continue to pour in from people sharing their own experiences with healthcare discrimination. The conversation hasn't stopped. The movement continues growing. More hospitals are implementing similar protocols. More medical schools are requiring bias training. More patients are speaking up when they experience discrimination. Change is happening. Not fast enough, not everywhere, but it's happening. And it started with one mother who refused to accept that her son didn't deserve care. If you've experienced discrimination in healthcare, document it. Record it if possible. Report it to hospital administration, state medical boards, and patient advocacy groups. Your voice matters. Share this story. Let people know that these situations still happen and that we can't stay silent. Support organizations working to eliminate healthcare disparities. Volunteer, donate, advocate. And if you work in healthcare at any level, speak up when you see discrimination. Be like Nurse Melissa, who texted for help instead of following unjust orders. Be like Dr. Chen, who provided compassionate care regardless of his colleagues' behavior. Be part of the solution, because the next Tyler Mitchell deserves better. Every patient deserves better. Subscribe for more stories about injustice, accountability, and the power of standing up for what's right. Hit the notification bell because these conversations need to continue. Drop a comment sharing your thoughts. Have you experienced healthcare discrimination? How can we create lasting change? Share this video with someone who needs to hear it. Because Tyler's story could be anyone's story, and together we can make sure it has a better ending for everyone. Justice isn't just about consequences for the guilty. It's about protection for the innocent. It's about systems that value every human life equally. That's the world Tyler deserves to grow up in. That's the world we all deserve. Let's build it together.